This medication is used to treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. It can also relieve symptoms of extra gas, such as belching, bloating, and feelings of pressure or discomfort in the stomach or gut. Simethicone helps to break up gas bubbles in the gut, while aluminum and magnesium antacids work quickly to lower the acid in the stomach. Liquid antacids usually work faster and better than tablets or capsules. This medication only works on existing acid in the stomach and does not prevent acid production. It may be used alone or with other medications that lower acid production, such as H2 blockers, like cimetidine or ranitidine, and proton pump inhibitors, like omeprazole. If you are self-treating with this medication, be sure to carefully read the package instructions before you start using it to make sure it is right for you. Some products have similar brand names but different active ingredients with different uses, so taking the wrong product could harm you. Ask your pharmacist if you have any questions about your product or its use. When taking this medication, it's best to do so after meals and at bedtime, or as needed. Be sure to follow the instructions on the package or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using the chewable tablets, make sure to chew them thoroughly before swallowing, and then drink a full glass of water. And if you're using the liquid form, be sure to shake the bottle well before pouring each dose. It's important to measure the dose carefully using a medication spoon or cup, and not a household spoon. Refrigerating the suspension may improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, but you can mix your dose with a little water if needed. This product may interact with other medications, which could prevent them from being fully absorbed by your body. It's important to talk with your doctor or pharmacist about how to schedule your medications to prevent this problem. If your acid problems persist or worsen after using this product for a week, or if you believe you have a serious medical issue, seek medical help immediately. And if you're using this medication regularly on a daily basis for more than 2 weeks, you may have a medical problem that requires different treatment. It's important to ask your doctor whether this is the right medication for you. Some common side effects of this medication include nausea, constipation, diarrhea, or headache. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. The magnesium in this product can cause diarrhea, but using an antacid that contains only aluminum along with this product can help control diarrhea. However, the aluminum in this product can cause constipation. To minimize constipation, it is recommended to drink plenty of fluids and exercise. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Antacids containing aluminum can bind to an important body chemical called phosphate in the gut, leading to low phosphate levels, especially if used in large doses and for a long time. It is important to seek medical attention if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. Additionally, it is important to inform your doctor if you experience serious side effects such as dizziness, fainting, slow/shallow breathing, irregular heartbeat, mental/mood changes, or allergic reactions such as rash, itching, swelling, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects, so it is crucial to contact your doctor or pharmacist if you notice any other effects not listed above. Before taking this antacid with simethicone suspension, make sure to inform your doctor or pharmacist about any allergies you may have to aluminum hydroxide, magnesium, or simethicone. It's important to note that this product may contain inactive ingredients that could cause allergic reactions or other issues, so be sure to talk to your pharmacist for more details. If you have health issues such as frequent alcohol use, dehydration, kidney problems, or phenylketonuria, PKU, it's recommended to consult your doctor or pharmacist before using this product. This medication may contain aspartame, so if you have PKU or any other condition that requires you to restrict your intake of aspartame, be sure to talk to your doctor or pharmacist about using this drug safely. Additionally, if you have diabetes, it's important to consult your doctor or pharmacist about using this drug safely as it may contain sugar. If you are pregnant, it's important to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. It's also recommended to consult your doctor before using this medication if you are breastfeeding. It is important to be aware of potential drug interactions when taking Antacid with Simethicone suspension. These interactions can affect how your medications work and may increase your risk for serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include phosphate supplements, such as potassium phosphate, and sodium polystyrene sulfonate. Additionally, antacids can interfere with the absorption of many other drugs, so it is important to check with your pharmacist before taking antacids with any other medication. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. Remember to attend all your medical and lab appointments. Making some lifestyle changes, like reducing stress, quitting smoking, cutting back on alcohol, and adjusting your diet, like avoiding caffeine, fatty foods, and certain spices, can help this medication work better for you. Have a chat with your doctor or pharmacist about any lifestyle changes that could help you. If you are taking this medication regularly and happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Don't take a double dose to make up for the missed one. When storing Antacid with Simethicone suspension, final dose form, it's important to keep it at room temperature and away from light and moisture. If you have the liquid form, you can store it in the refrigerator to improve the taste, but be sure not to freeze it. It's also important to keep all medications away from children and pets. When it comes to discarding this product, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.